Just like veins, lymphatics join together in ever bigger vessels. They usually run in a bundle with arteries and veins. You've seen a few of those by now, right? Where the arteries and veins are sort of bound together. There's a lymphatic in there too. Like I said, they're just very hard to see because their walls are so thin. This slide also shows you the valve structure. Very thin, but that is a valve. It would allow flow this way, right? But if fluid tried to flow backwards, it would go along the sides and close the valve. See? So it is in fact a one-way valve, even though it's a very thin little flap. So the pump is the skeletal muscles around that. This is yet another reason why when we sit for a long period of time, our feet and ankles swell. Yes, most of it's cardiovascular, but some of it's lymphatic too. So as you get up and walk around, you're actually mobilizing that lymphatic fluid as well. Now, where does this system end? It ends here and here. The thoracic duct and the right lymphatic duct are where the lymph system dumps back into the cardiovascular system. Now remember, by the time we've gotten here, we've passed through at least one, probably more like 5 or 6 lymph nodes to get here. So the fluid that's entering the blood system has left the lymph nodes, which means it's clean, right? So we can dump it back in there. The 2 spots that we dump it are right where the jugular vein intersects with the brachiocephalic or the subclavian vein, right? So it's sort of at the angle. So we have our right lymphatic duct here, and we have our thoracic duct, which you could call it the left lymphatic duct. Now, this is one of the examples of asymmetry in the body. There aren't very many, and I think because of that, they're worth knowing. Lymphatic drainage is very asymmetric. The thoracic duct on the left side drains the whole left side of the body and the lower right side of the body. The right thoracic duct, the right lymphatic duct here only drains the right side of the top third of the body, right? So right arm and half of the head and chest. So it's profound asymmetry. The thoracic duct also plays a major role in transporting lipids from the digestive tract into the blood where they can be utilized. And we're going to talk at length about that. But one of the things that you'll see in the thoracic duct, which I encourage you to find when you crack the chest. Have you cracked chest yet? When you do and you get all the mediastinum out, hopefully some of you will be able to find a thoracic duct. Be careful, they're very thin. But the thoracic duct in life actually carries a kind of whitish, almost milk-looking substance, and that's from all the lipids that are being carried from the digestive tract up through that system and into the cardiovascular system. It's kind of neat. We call that chyle, C-H-Y-L-E, is the fat-rich lymph that comes from the digestive tract. So know where it enters the cardiovascular system, because this is effectively the end of the lymphatic system. Once the lymph dumps back in, it gets mixed with the blood, and now we've closed the loop. That fluid that had leaked out of the vessels but didn't leak back in gets returned through the drainage system, right, after being cleaned by the lymph nodes.